Hi, I'm Peter Glowicki from Mayo Clinic, editor-in-chief of the Journal of Vascular Surgery. I am pleased to introduce 4 great papers from the 2022 May issue of the JVS. Each of these are freely available to read or full text download for the next 2 months. Our first article is the editor's choice and our CME articles for this issue. It is entitled Prevalence of Abdominal Aortic Aneurysm in Patients with Lung Cancer, written by Dr. Khaled Al-Nahal and colleagues from Boston, Massachusetts. In this retrospective review of prospectively collected national inpatient sample data, 158,904 patients with primary lung cancer were studied. Patients with lung cancer were found to have higher odds of abdominal aortic aneurysm with an odd ratio of 1.43 compared with the general population. Among patients with cancer in all age groups, female smokers had a higher rate of abdominal aortic aneurysm compared with female non-smokers, and this was statistically significant. The take-home message was that lung cancer and abdominal aortic aneurysm share similar risk factors, and current policies not screening female smokers should be re-evaluated. The next article this month is titled Physical and Psychological Functioning of Patients with Chronic Limb Ischemia during a 1-year period after endovascular revascularization. This was written by Dr. Violetta Banas and colleagues from Bydgoszcz and Torun, Poland. In this prospective cohort study at 12 months after revascularization, improvement in PAD-related symptoms of leg ischemia was evident in 56% of the patients who presented with chronic limb-threatening ischemia and in 68% of those who presented with claudication. Patients with improvement of symptoms also had improved scores in general physical, psychological, and cognitive functioning, such as for activities of daily living, mini-mental state exam, and in the hospital activity and depression scale. The third paper I'd like to introduce is entitled Outcomes of Balloon Expandable versus Self-Expendable Stent Graft for Endovascular Repair of Iliac Aneurysms using iliac branch endoprosthesis. This was written by Dr. Guillermo Lima and colleagues from Houston, Texas and Rochester, Minnesota. This was a retrospective study of endovascular repair with 108 iliac branch endoprosthesis using balloon expandable stent graft in 43 and self-expendable stent graft in 65 targeted internal iliac arteries. Balloon expandable stent graft was more frequently used for internal iliac artery aneurysms requiring stenting into divisional branches, 36% versus 5%. Technical success, freedom from buttock claudication, and freedom from reinterventions were similar between groups, and the only significant difference between the groups was internal iliac branch instability. Balloon expandable stent graft had lower freedom from internal iliac artery branch instability, 87% versus 96% for self-expendable stent grafts. The final article I'd like to introduce you today was written by Dr. Elizabeth Andreska and colleagues from Pittsburgh, Pennsylvania. It is entitled Contemporary Management of Acute and Chronic Mesenteric Ischemia, a 10-year experience from a multi-hospital healthcare system. Now, this was a retrospective study. It included 148 patients with acute and 259 with chronic mesenteric ischemia. The 30-day mortality for acute mesenteric ischemia was high. It was 31%. Open revascularization was associated with lower rates of bowel resection, with an odds ratio of 0.23. The 30-day mortality for patients with chronic mesenteric ischemia was 7%. Patients who had endovascular revascularization had lower rates of postoperative major adverse events, but they had higher rates of symptom recurrence compared with those who had open mesenteric bypass, 29% versus 13%. So the take-home message of this paper is that patients with acute mesenteric ischemia continue to have high mortality, and that endovascular intervention decreased postoperative morbidity of chronic mesenteric ischemia, but resulted in early symptom recurrence and need for reinterventions. These were just 4 of the many excellent papers we published in the May issue of the Journal of Vascular Surgery. Please read our journals, follow us on social media, send us your comments, and send us great manuscript for publication. Thank you for watching, and see you next time for the highlights of the June issue of the Journal of Vascular Surgery.